Well, we all know the celebrities have been using Botox for years. We've heard about it for a long time. But did you know more everyday Australians are turning to cosmetic treatments to keep them looking younger and fresher? A record $448 million was spent last year on non-invasive procedures like Botox. So why is it popular? To tell us more, Botox user Kathy Nesby and cosmetic surgeon Dr. Rastogi join us. Hi, Anoop, and hey, Kathy, welcome.
Thank you, Kerri-Anne.
Now, Kathy, as I said, celebrities have been using this for ages and ages. You're a regular girl like the rest of us, a woman. Why did you want Botox?
I just wanted to feel a little bit fresher in my look. So I was looking a bit tired and I thought, I didn't want invasive surgery and I thought Botox was the way to go.
So what happens? Did you do your homework? What did you expect?
Well, I did do the research before I went into it, and I just thought that just a little bit on my forehead, that's all I needed to do.
Yeah, so point out where
just along here. That was about it. I just wanted to sort of keep that a little bit fresher.
Because what were you frowning in your head?
I was frowning, and it's just part of my natural sort of demeanour that I do frown, and the doctor pointed that out, and I thought, oh, I better get something done about that, so I did.
And are you happy with the result?
I am, yes, and I will go back and get it done again.
Okay.
Yes.
And then, for the uninitiated, what is Botox? Because I know it's been around for about 40 years, but what is Botox?
Botox is very simply a medication that relaxes muscles, and so what we find is when you get overexpression in the face, and classically is exactly what you're talking about, the very strong frown line in the centre of the forehead, what it does is it relaxes that to reduce the intensity with which it contracts, and it makes the wrinkles disappear.
Yeah, with that frown line, which is, as we age, it inevitably happens if it's a bit of a family trait. Nothing like waking up looking cranky. There's enough to get cranky about during the day.
That's right.
No, it's actually very true. Particularly in Australia, where there's plenty of people with pale eyes and when there's very strong sunlight, that there's a common, it's very common to squint, and also when one's expressing, when one's reading, you get a lot of squinting, and that produces that frown line that makes one look angry even when they're not. And so it's the most common one that's Botox.
It's not only used on the forehead, there are other areas as the treatment has progressed. Where else do people have it?
Botox is actually, it can be used virtually anywhere, but commonly we use it for the frown lines, for the crow's feet around the eyes. We use it across the forehead for the worry lines, the wrinkle lines. And so that's in terms of dampening down lines and wrinkles, but we now also use it to lift the eyebrows up, lift the corners of the mouth and lift the jawline as an anti-gravity effect.
That's what you call the
Nefertiti lift, that's right.
Okay.
Yes.
And so how relaxing those muscles there, how does that work then?
Well, basically, gravity...
Normally, I think if you're going to relax them, they're going to be down around your knees.
Exactly, yeah, it's counterintuitive. The face naturally relaxes and gravity naturally pulls down. What we do is, there are muscles that aid in the pull down and there are muscles that aid in the lift. What we do is relax the muscles that would pull down so that the muscles that get a lift produce an advantage. And so the balance of those is that we get a lift rather than a fall, and so Botox can lift the face.
How did you tell your friends? Clearly you're on TV talking about it, and did you tell your friends?
Not at first.
No?
No, because it's sort of like a little stigma attached to it, isn't it? But
Were you embarrassed?
Oh, not embarrassed, but I thought, oh, now they're going to know.
Very interesting, isn't it?
But no, I'm glad I got it done, and they're really surprised at the way it's turned out.
Did they pick it?
No, they didn't pick it because it's the way I used to wear my hair.
Oh.
Yes, I always had that fringe. Now I don't need that fringe.
Okay, so they've noticed it's a new hairdo.
New hairdo, yes.
And I mean, it's not, I guess, as you say, invasive surgery where there's cuts and stitches and all that.
It's not.
Just makes you feel fresher. So what do they really say? Are they rushing off to going, well, I want what she's got?
Yes, they are. They are. I've given out the number to quite a few people, so no, they're quite happy with how I'm looking at the moment, which is good.
And are blokes doing, I'm talking $448 million worth of non-surgical procedures, stuff like Botox. Do blokes do it?
Of course they do.
Really?
Oh, absolutely.
How come we don't have blokes talking about this? Girls are, ready, willing and able to talk about it.
Blokes from two different aspects. You've got just your average bloke coming in because the wife's coming in to have her Botox and she says, you're coming too. If I'm looking good, you're going to be looking good too. And the others are professional people who need to look young and vibrant and happy. It's a dynamic economy, and it's and therefore people need to be dynamic within that economy. And so when you're looking to advance, you cover all of your bases. And if that
single
helps you,
most important thing to look after our skin in terms of anti-aging.
Oh. Look, sun protection, without a doubt. Sun protection. Don't smoke. Be careful with your drinking. Plenty of fresh fruits and vegetables where all your antioxidants are.
Yeah, great. I'm a girl from Queensland. I know all about that. Hey, Kathy, congratulations. I'm glad you're happy. And thanks for talking to us about it, taking it out of that that celebrity Hollywood frozen world. We appreciate your time.
Thank you.
Kathy Nasby joining us, along with Dr. Rastogi.